We are starting to see an increase in the number of COVID patients that are being treated in the emergency room and released, as well as the ones who are being admitted to the hospital, similar to what we're seeing in other parts of the county, as well as across the country at this time.
This is really important for the community and for our patients to know. It is absolutely safe to come see your provider, whether that be in the hospital, in a provider's office, in an urgent care setting, or our emergency room. What we don't want is our patients to ignore any symptoms or ignore their healthcare needs during this pandemic. We don't want a second public health emergency because people are ignoring their healthcare needs.
One of the benefits that we've had is some time to prepare since this pandemic began. So the good news is that we now know much more about this virus, about how it's spread and how we can protect both patients and staff through the proper use of PPE. In addition to that, we are testing people prior to any scheduled procedure, and as well as all patients who are being admitted through the emergency room. The good news is that we've had time now to find additional sources of personal protective equipment, including gloves and gowns and masks and the respirators that we use. So we now believe that we have more than enough personal protective equipment to last us at least 6 months, to in some cases even up to a year, even in the face of a surge. And so we are well prepared. We can keep our patients and our staff safe at this time. We have been monitoring the amount of equipment that we have, including the ventilators, and we're well prepared for a potential surge. Cedars Sinai has been selected as a early allocation site, so we will be amongst the first to receive the new Pfizer vaccine. This vaccine requires ultra cold storage at minus 80 degrees Celsius. That's much colder than a usual freezer. So we are putting special processes in place to make sure that we can receive this vaccine and keep it at those ultra cold temperatures, thawed at just the right time, and reconstitute it so it can be administered to those who need it.
Depending on the type of vaccine, a vaccine can either prevent a disease, it can either minimize the chances of acquiring a disease, or if you do acquire a disease, it can minimize the severity. With regards to the COVID vaccine, specifically in the Pfizer vaccine, it's a 2-dose vaccine, so meaning there is a dose at day 1 and a dose at day 21. And the first dose is again to help our body build immunity, and the second dose is to strengthen that immunity. What's really important to know is that all of the vaccine development in the United States with regards to COVID do not contain any infectious particles, so you cannot get COVID from any of these vaccines.
It's very exciting that there's a number of vaccines that we anticipate will be available shortly under the FDA emergency use authorization. In order to receive that authorization, the early data has to show that the vaccines are both safe and effective. And these early trials are clearly demonstrating that.
The CDC may advise for those folks that have had COVID in the past to get the COVID vaccine for a number of reasons. Number one, and very importantly, we don't know how long natural immunity lasts to COVID. Number two, there are severe health risks associated with COVID. And number three, reinfection is possible.